Well, when I was diagnosed, this was back in 2006, there was not a lot known about paediatric MS. At the time, I remember being diagnosed in the room and thinking to myself, okay, that's great, now we have a diagnosis, now we can deal with it. Little did I know at the time that this was a lifelong condition with no cure. My parents around me broke down. I can just remember them bursting into tears, and at that point, that's when I thought, what is this that we're dealing with? And I remember speaking with them after and them saying how they never understood it was only older people that were diagnosed with this. How was I going to live my life here forward? Was I going to be able to finish school? Would I be able to attend further education? What about work? What about family? They had so many questions on their plate that not even myself at the age of 15 had begun to even think about. I was 15 years old, I was at school. Why would I even think about these things? Everyone seemed very confused, including myself. At the time, it was... I couldn't even draw parallels to it now, looking back. There was no support available at the time. As we were told by societies and by neurologists, paediatric MS was very rare, but not unheard of. But there was nothing in place for support, and we were basically left to our own devices. On you go. This is the treatment that we recommend. You're the first person in Scotland to be put on it, and no one can respond to your questions and no one can answer them. So deal with it on your own and we'll see how things go.
My daughter was diagnosed with MS when she was 11. But probably she has had MS since she was 8 or 9. We always knew there was something wrong with Ragnar Elisa. She was always complaining, always tired, aches all over, need a lot of motivation to get started. And she had, her balance was not good. So in May 2006 she was examined by a pediatric neurologist, and they were taking MRIs because they expected a brain tumor. And I got to see the pictures, and I have seen MRI picture of MS patients before, so that was a shock. For me, there was no doubt. It was looking at a snowstorm in my daughter's brain. But Ragnar Lisa's father has MS, and my granddad has MS. So I know what it's all about. But I didn't think that it was possible for children getting MS.
Bad things started when I was 14, and I was like getting pain quite a lot, and I went back and forth to doctors and hospitals and said it was just my age, and they said, what do you expect, it's like teenagers and all that. And then when I was 15 I got diagnosed with optic neuritis, and then I had to go to hospital quite a lot of eye tests, and then a couple of weeks later they said that I might get MS. Nothing, it's just a might be, might not. But then I was getting more pains and more like different like headaches, ridiculous headaches, and then we just kept on going back to the hospital, and they just gave me an MRI scan and they said, oh, it's nothing, go home. Or they gave me, I had a lumbar puncture and they said, oh, go home, we don't know what it is. Many times we went back and forth to hospital, and my mum was saying that there is something wrong, because this is my daughter and stuff. And then they said again that, well, it's probably, you might get MS in later life. And then they said in November we'll have another MRI scan to double check, and then got diagnosed in January.
She's probably been struggling with health for 3 or 4 years before that. Tiredness, fatigue. Then in April of 2017 we went to the doctors. She was sleeping for 2 or 3 days at a time. So we went to the doctors to discuss what we could do about it. And at that point the doctors kind of said it was a natural teenage thing. She was sleeping a lot. but it was kind of, we knew that you know your child, you know your daughter, you know that it isn't normal to sleep for 2 or 3 days at a time, no matter what age. That was started the ball rolling for future thought processes. Later that year, she got optic neuritis in July 2017. So she had a swelling on her eye. She went blind in one eye, and all her cheeks swelling up. So that was kind of key that something wasn't quite right. So we went to the hospital, ended up in hospital for 5 days, where they looked at it being optic neuritis. We talked about the MS at that point, but they discounted it. They said it was a first instance of the optic neuritis, so that should be okay. Injections and things like that should result in it being okay. And that was probably the first part where, as parents, we got a little concerned, worried, anxious. It's like your daughter's ill in hospital. What's happening? You feel like you've lost control. You like to be in control of your children and their progression, and we were out of our control. So that went on for a few months really. Just the optic neuritis reduced, but she was still in pain all over her body and things. Then she had an MRI scan in November of 2017, and we got the results of that in January, and we got a diagnosis of multiple sclerosis at that point in Sheffield. And that was kind of quite heartbreaking in one respect, but I guess on the other hand, we knew what it was at that point, so at least we'd got a diagnosis. We could then move forward. So we're quite a strong family, and I think that knowing what it has been diagnosed as, we could, as long as we got the right support and right help, we could help Eleanor progress and move forward with her life.
I'm Evangeline Vosmer. I'm a paediatric neurology consultant in the UK. I work at a big hospital in Birmingham Children's Hospital. I established the first paediatric MS clinic in the UK in 2004 after having worked in Canada for a few years with and seeing how paediatric MS is managed very differently than the UK. The biggest challenge is that we have a child who has an adult disease. So MS healthcare systems are geared towards adult MS services, but pediatric MS is a small part of that service. And in fact, in most healthcare systems, the children will be seen by pediatric healthcare professionals and not by adult healthcare professionals. So they don't have the knowledge, they don't have the expertise. And this healthcare system isn't built around pediatric MS services, whereas it's all geared up for adult. So they get a bit lost, really, in the bigger adult MS world.
Parents face a big challenge in terms of employment because, for the most part, children and adolescents have younger parents and who are in employment. Children who have problems with multiple sclerosis, like a relapse, or have adverse effects due to the therapies that they're on, require perhaps that their parents need to be at home with them instead of at work while their child is at school. In Italy right now, what happens to parents is that they have to use their vacation time in order to care for their child who is trying to face MS and maybe isn't attending school every day. This becomes a hardship for the family because the free time of the parent that they should be allowed through their employment is utilized in facing the challenges of MS instead of for what it's really meant for in spending time with the family.
The support they received was very limited. At the time, there was a few publications that were given to my parents explaining what MS was and the projection of what MS was going to be like, how it would affect me in the long run. Nowhere in that did it mention that, hold on a minute, actually everyone's outlook is completely different, and we can't tell you at this moment in time where your son will be in 5, 10, 15 years time. I can't really reflect back in the time, but in speaking to my parents, I know they attended the local MS society in Scotland, and received publications on paediatric MS, although it was unknown of at the time. There was a few literature reviews and publications done, but the support for them was very limited. I know my urologist provided them with that. That was in the form of a DVD, there were CDs, there was publications, again, very clinical. There was no real personal information in it as to where they could go for support or how I could get support. It's more just, this is your treatment and this is how it will be administered, this is how it will affect you in the future. So in summary, I'd say there was information provided, but it was far from meeting any needs of either my parents or myself.
Information needs to be readily available for carers and parents, but also for the young people. And it needs to be a team approach of how we manage the patient best, of which all participants should be part of. So information is key, and that information needs to be in different ways of doing it. Healthcare professionals generally like to write long texts, which are usually quite a lot of jargon in it, which is maybe not so accessible for parents or the young person. We may need to consider using something like an online training module where they actually get tested a little bit as well, so that they actually understand what we're talking about. So information, different ways of providing that information, but even one-to-one support. So where you as a healthcare professional actually take time to go through the treatment and the management of MS in greater detail, really addressing specific questions that the parent, carer, or the young person may have.
Caregivers of children and adolescents with multiple sclerosis in Italy sometimes have trouble accessing information about multiple sclerosis, especially diagnosis, treatment options, symptom management. And the main reason for this is because the MS experts who see adults with multiple sclerosis aren't experts, let's say, in dealing with children. And on the other hand, the pediatric world has little access to gaining experience about the complicated therapies that are available for multiple sclerosis today. So what happens is the families, the caregivers and the children are caught in between because there isn't a network right now in place that connects the pediatric world with the adult multiple sclerosis world. And so this is it creates a disadvantage for the families and for children.
We need to be aware about the need for carers and for the young people. I think initially it is often the parent who struggles, and they have to come to terms and adjust to the diagnosis. They lose a lot. So there's a lot of grief happening as well, because their perfect child has now got this chronic disorder. They may have hopes and dreams for their child, which may need to be adjusted. It may not be that they have to give them up altogether, but they may have to adjust them. And they have to come to a new balance where they kind of get used to or live with this new diagnosis. The timing of that can be at the diagnosis, but for some parents it may only be when treatment has started that they go through this process of having to have that extra support. And for the young person, it can be even later. So often it only happens as they move into adult services, because for many young people in the beginning, health is a problem for the parent, not their problem. So you have to be very sensitive as a healthcare professional to what the need may be and when is the right time to get support. In many countries, including the UK, psychological support as such is not easily available. So it may mean that you may have to think of other ways of getting that support. It may be that I, as a doctor, need to learn some counselling skills, some basic counselling skills. But the other thing is, if you have a nurse in clinic to support it, we need to empower the MS nurses by giving them some training. Because in basic psychological support.
We didn't get any psychological support. So as I say, that was January. And looking back, we tried to get through it ourselves. We probably should have asked for help a little bit earlier to help Eleanor understand. However, we did get the psychological support for Eleanor. She had a hospitalisation in November of that same year, so 11 months later, and she got then some counselling from school. So that really helped her. But my wife tried to go through the doctors, the local general practitioner, and got told that she couldn't see anybody for 12 months until after Eleanor's diagnosis. She wasn't classed as kind of an important or relevant at that moment in time, which I feel would have helped at the time. You can see, and talking around the table when we've been in the workshop today, you can see it's clear that those first few months are the most vital months, and my wife could have dealt with it better had she had some psychological support. I can't, perhaps even me, I think I might have needed it, but I wouldn't have probably held my hand up and said I needed it. But I think my wife would have. And as I say, it's kind of, she's only just getting that psychological support herself.
Having a daughter with MS, it's not impossible. You have to manage. When someone you care for gets a diagnosis that they will have the rest of their lives, it gives you a shock and many worries about the future. I think all parents will do everything for a sick child, and for me it was heartbreaking that it was so little I can do than just be a mom.
The education system, in response to difficulties that families, children with multiple sclerosis have in the school context, is very complicated. Because MS is considered, for the most part, a rare disease. It's difficult for MS societies and other patient advocates to have direct contact with schools, because maybe some schools will have no children. Most schools probably will have no children with multiple sclerosis. So it's very important that the effort between the multiple sclerosis organizations and the healthcare team, the multiple sclerosis care team, work very closely with the parents and families and children with pediatric multiple sclerosis, because the intervention will be it will depend very much on the individual needs of the family and the relationship they already have with the school, and how much they ask the MS Society and the healthcare professionals to support them in having a dialogue with the school to make sure that their children get the care and support that they need. The education system needs to understand the needs of a person with multiple sclerosis, a child with multiple sclerosis, and their families, in order to meet the needs that they have, which are cognitive and also related to peer and social interactions. By working with sometimes the MS Society, if we are involved by the family, but definitely with developing a relationship with the family, they can better understand the illness and better understand the needs of the child.
It was mostly people understanding, because I remember a few months ago I had trouble with some lads, and I was walking upstairs on my crutches and they were pushing me, and then the teacher was saying, like, would you do that to an 80-year-old woman on crutches? And they were saying no. Well, it's just the same, because they don't understand that people my age have a disability and can be hurting and in pain a lot, and they don't realise that people can be doing it, but they don't, because it's not one of them in a wheelchair. Like a few of my friends said to me the other day, "You're actually disabled?" I was like, "Yeah." They went, "But you're not in a wheelchair." I went, you don't have to be disabled, and that's what I think a lot of people don't understand, and they need to show that it's not all about being in a wheelchair and on crutches and all that. At first I didn't really know what it was, so like I just thought I was like normal like everyone else, and I was like going out every night until late, and then I was tired and didn't go to school, and I was like, and my mum and dad was like, you can't do this, and I didn't understand that I can't but other people can, and I just didn't get to why I couldn't. And then I've learned that I have to pace myself, and that if I want to do something I have to rest for a week. Like if I go away I have to go and have a week or two before where I'm just sleeping, or my friends come to mine, or it's not like going out every night and stuff. I have to pace myself, and if I struggle then I listen to my body. Like I don't just push myself. If I'm not feeling well I have an extra hour in bed and then go to school, or if I'm not feeling well I do my work at home. Like I do manage it, but just around what I feel in my body. And school are okay with that, mum and dad listen and everyone.
Decision makers should provide parents and caregivers of pediatric MS with employment protection. They should also work with MS organizations in creating awareness, increasing awareness about pediatric multiple sclerosis. Decision makers should assure that families that are facing pediatric multiple sclerosis have the financial resources they need so that they can access all the treatment available, anything from psychological support to symptomatic therapies. It's important that decision makers understand the importance of having healthcare professionals that are expert both in the pediatric field and in the field of multiple sclerosis. It's important for decision makers to understand the relevance of research focused on pediatric multiple sclerosis. Patient organizations cannot take responsibility alone for funding this type of research and need to work with government and decision makers in order to have common goals.
Out of state, I have been paid full salary when I had to be home with my daughter for long periods. I have an employee that's been very patient with my long absence, and they have arranged for me so that I can have a home office and arranged meetings by Skype and telephone and so on, so I can be at work but at home with my daughter. For me, having economic security has been crucial to manage the situation.
There has to be an massive educational push towards younger people with MS or young people with any neurological condition. What is their needs? What is the policy review of the support networks that are available for people with MS locally and at a more national level? The support networks as well, I think policymakers should be looking at is how people can connect with each other. That was a crucial point of support, not only for me, but for my parents as well. And that's where the real support had come from. And there's a lot of hoops, I know, to jump through to get that sort of policy in place, but I think it'd be very beneficial. I also believe that there's a huge gap missing from the transition period of paediatric care to adult care. A very difficult and confusing time for any child or adolescent living with any condition, but you're put in a ward with adults and you're expected to just get on with things.
So if the neurologist at the outset could have directed us to a specialist, an MS specialist sooner, so an MS nurse or an information programme that we could then look at ourselves, and that would help us not only with Eleanor but with our family as well, and even the schools. So the schools might not have got anything, but we could have discussed the schools at that point for them. It's not a minor illness, but it's a rare illness in children, so schools aren't really aware of it. So I guess it's the experts, the technical experts, the policymakers' job to provide better information so that we can, as I say, I'm confident enough to go into schools and talk to the schools about it. Is there a program in place so we can pass some information on to the schools so they can look at it for their patients, for their students that are involved in that, and so they can direct it down to their teachers. So that would probably be a help. The other thing I've thought of in that space is, can some experienced caregivers, so me a few years down the line, 4 or 5 years, somebody else gets diagnosed with it at a school, 14 years old, can me as an experienced caregiver go and give a talk to the parent, to the teacher, and even have the healthcare professional there, but can we get some experienced people to help that student? Because if we'd got somebody in school to help Eleanor at that point, it would definitely have improved Eleanor's situation in the first few months at school. Earlier intervention of all the things we talked about, so the psychological support, rather than wait 9-12 months, how do we get that earlier? Because 12 months down the line, we were in a far different place. We were comfy with everything. We needed some support initially. So it's how do we get that in place? We didn't get access to a multiple sclerosis nurse for 12 months because Eleanor was 15 and there wasn't one locally, so we had to wait till she was 16. So can the policymakers do something where Eleanor could have had access to an MS nurse within the first 2 or 3 months? Because that would have made it far clearer and beneficial, because now we've got access to that MS nurse, we are in a different place, and every time we want to speak to that nurse, we ring her up and they give us the right answers and relax us and make us comfortable about what we're asking. From an educational point of view, I think it's important that we get something in place that, whether it's an information booklet, whether it's some online process, that the school, we can say to the school, my daughter's got diagnosed with multiple sclerosis. If you just look on the system, you can see what help you may be able to help our child with, and therefore it may help you as a school. Whereas, because Eleanor's head teacher is really passionate, but she didn't know where to go to look for it. Whereas she got that information in place straight away, that would have been key as well. And I think, obviously, these youngsters getting it 5-6 years old, but for Eleanor being 15, I think the link between the paediatric and the adult services, the link could be a little bit better. We've kind of had some challenges in terms of who's in charge of us. Everyone is fantastic. Everyone knows their job. It's just there seems to be certain things held back by the system. And I think if we can just work together, the MS societies, the education people, the neurologists, the experts around the table, if we can work together and relax that and be more flexible, I think that will help Eleanor and it'll help future generations of MS sufferers upon diagnosis.
At first, I didn't really know what it was, so like I just thought I was like normal like everyone else, and I was like going out every night until late, and then I was tired and didn't go to school, and I was like, and my mum and dad was like, you can't do this, and I didn't understand that I can't but other people can, and I just didn't get to why I couldn't. And then I've learned that I have to pace myself, and that if I want to do something I have to rest for a week. Like if I go away, I have to go and have it like a week or two before, where I'm just sleeping or my friends come to mine, or it's not like going out every night and stuff. I have to pace myself, and if I struggle, then I listen to my body. Like I don't just push myself. Like if I'm not feeling well, I have an extra hour in bed and then go to school, or if I'm not feeling well, I do my work at home. Like I do manage it, but just around what I feel in my body. And school are okay with that. Mum and dad listen, and everyone. I've always done dance, and I've danced for 12 years, so I've always done dance shows, and that helps me with my MS because it's exercise, and I like to go out with my friends walking, going to like shopping and stuff like that, so that helps. And then when I leave school, I want to go into photography and be a photographer and doing stage, or I don't know, just getting work experience